Welcome to On the Beat. Today I'm joined by our friends at Gastroenterology Associates of Columbus and Starkville. I have Dr. Ricky Johnston and Dr. Richard Hurd with me today and talking about a very serious subject that we feel is so important to talk about often, and that is colon cancer. And so what is colon cancer?
Very simply, is cancer in the colon, obviously. The colon is the last part of your intestines. We also call it the large intestines. It's responsible mostly for absorbing water, but it is very prone to having cancer.
And why is that? Do we know?
Well, we could get into the science of that, and that's a little bit deep, but mostly it's just important that it does get cancer.
And then how common is colon cancer, and what ages are you seeing it?
It's very common. So according to American Cancer Society, lifetime risk is like 1 in 20.
My goodness.
So if you think about, a Sunday school class or whatever a group of 20 might be, that's a lot of people.
It sure is. And then one thing that we were talking about just a moment ago was not waiting until symptoms.
Right.
So talk about that.
Yeah, there's a recommended time to screen, and for most people that's age 45 if they're not having any problems. Earlier than that, if you've got a family history, age 40 perhaps, or even earlier depending on when your family member was diagnosed. But certainly you want to go at your time. Don't wait till you have problems. If you start to have symptoms, then that could indicate, not always, but that the cancer could have progressed more. So we don't want to wait till symptoms if we can avoid that.
And who do you find typically is at risk for colon cancer?
Well, everybody, but
Okay.
there are certain risk factors. The big one is family history. So if you have a first-degree relative who has a history of colon cancer, you definitely need to get screened. And then there are some smaller risk factors such as obesity and some unhealthy lifestyle things, but
smoking is an important one. I tell people
yes.
too. Just people equate
Really?
smoking and it's lung cancer risk, but smoking increases your risk of really any malignancy in your body. So
Any cancer?
Yeah.
So if somebody's diagnosed with colon cancer, is it curable?
Yeah, it can be if you catch it early enough. Sometimes we take out large colon polyps that already have cancer in them. And as long as you meet certain criteria on the pathology regarding how deep it is and how big it is and things like that, even removing a cancerous polyp can be considered curative when they don't have to have any further treatment. But if it's progressed beyond that, you can take out that section of the colon, reconnect things, and it can be curative. Sometimes it might require chemo before or after, depending on different staging, which would be more of a determination made at the time of surgery, and then based on some x-rays we would perform after a diagnosis.
And people ask me all the time, in clinic, hey, I'm not having problems. Do I really need to have this done? That's probably a quarter of people. And the answer is yes. Because of this, you want to catch it before it spreads. If you let it spread, you're just kind of kicking yourself.
And preventative too.
Preventative, yes.
Yeah, and colon cancer is preventative by removing polyps. And that's really what we spend the bulk of our time doing, is taking out colon polyps. Taking out a polyp prevents that from getting bigger and becoming cancer later in life.
Absolutely.
Well, very important information for people of all ages. And if you would like to get information about how you can check with the doctors about screening and colon cancer questions, the information is on your screen.